We're now joined by Dr. Jeffrey Le Benger, who is board chair and CEO of Summit Health. Good to see you, Jeff.
Thank you for having me today, Steve.
You got it. By the way, Summit Health is, in fact, an underwriter of the healthcare programming that we produce and broadcast. But Summit Health is a new brand, new name. Talk about that, Jeff.
Right. So 18 months ago, Summit Medical Group merged with CityMD, and we are trying to bring our integrated healthcare model to the entire New York metropolitan area. And after 18 months, we are rebranding the name to Summit Health. CityMD will still be branded as CityMD, but it will be a Summit Health company. And as you know and your viewers know, that we are a fully integrated company in northern New Jersey. We have every ancillary, we have every specialty. We just don't own a hospital, but we believe in healthcare outside of the hospital to the ambulatory sector. We partner with hospitals. Our doctors go there for tertiary, quaternary care. But for us, it all has to do with the gaps of care that a patient has, the transitions of care that a patient needs, and care managing that patient to the best quality and outcome they could have.
Doctor, you were actually on Governor Murphy's healthcare affordability advisory group, you and a whole range of other healthcare leaders. A, what is that advisory group's mission? And B, the longer term impact of COVID on, quote, affordability, and we'll get into access as well. What is that advisory group all about?
Well, I think they're going to look at how healthcare is fragmented and very costly, and they're going to look how to increase the integration and the care management of patients within the New Jersey marketplace. And as you know, that's what we do. We really are integrated healthcare model, Summit Health, that manages those patients really well. And I think we are going to have our first advisory meeting, I think it is tomorrow, and we are going to get our mission, our vision, and what we do stand for, and what we are going to try to achieve in the state. But what I am told that we are going to be part of trying to assimilate a culture within the state to have an integrated healthcare model to have high qualities at a lower cost point.
You know, Doctor, it's interesting. By the way, 700,000 patients in the northern New Jersey area that Summit Health is responsible for. But I want to understand this. COVID has impacted the world of healthcare on so many levels, as you well know. And you are, by the way, a practicing physician. I want to make that clear.
Yes.
But telehealth, I coach and teach communication skills to a whole range of physician leaders. And one of the issues that keeps coming up is the question of telehealth and the ability to communicate and connect physicians to their patients. A, do you believe telehealth will be even bigger moving forward? And B, what needs to be done to get physicians ready to be the best they need to be via telehealth? I know it's a complicated question, but if there's going to be more of it, how do we get our physicians to be better at it?
Okay, so let me take the economics out of it first. Before,
sure.
Telehealth was never reimbursed. Now the state is reimbursing a telehealth visit as par with a visit within the physician's office.
And that's new.
And that's
new.
That's new. That happened with COVID, and it's going to continue. With us at Summit Medical Group, we went during COVID from maybe doing 10 or 12 a day of telehealth visits to over 4,000 in one day. So it was an unbelievable beta about how to handle a patient. And now we are very comfortable in doing telehealth visits. And I think there is going to be a need for telehealth to be part of the access of healthcare. That's why with us, why we merged with CityMD. It's all about access points for healthcare, for psychosocial, socioeconomic, physicality, whatever the issue might be. You go to a CityMD, you have a virtual healthcare visit, or you come see in the integrated healthcare model. We are now coming out within a month or two with a digital app that will have virtual health on it that you could just plug in and do a virtual visit right then and there on your phone. It's a great app. So I think the doctors learned during COVID how to do telehealth. And I think it's going to be a great addition to their model of healthcare delivery throughout the entire country. because not every patient needs to come in for a sore throat or an earache, right?
But some things they do need to come in for, correct?
Correct. Well, during COVID, we found a lot of patients were afraid to come in, and we have to get healthcare back where it was.
You know, our whole mission is obviously to provide credible information about important medical, clinical, healthcare issues. And let's talk about the vaccine. So I know you've been out there, you've been speaking on this, you talk to your patients all the time about it. There is still a degree, Dr. Le Benger, of resistance, pockets of it. What would you say to those watching right now who say this? Listen, they don't need me. I'm not sure I want to get the vaccine. There'll be herd immunity. They don't, you know, and by then we'll be fine. What would you say to those folks who are just hanging back?
So me being a physician, not to be tough about this, but that's part about being a human being, is to have a safety net for other human beings. And if you could help that, okay, and get a vaccine to prevent the disease, to prevent the spread of the disease, you might not be worried about yourself, but worry about others you might come in contact with, who they might come in contact with, and then it's an elderly, maybe an overweight diabetic that has an increased incidence, or a Black or brown or Hispanic person who for some reason has a higher incidence with, and they get it and they go to the hospital or they unfortunately pass away. That's what herd immunity is about. You live in civilization, you live in a community, you are also there to help protect others. That's what we're all about. That's why a vaccine is so important.
You've been listening to Dr. Jeffrey Le Benger, Board Chair and CEO of Summit Health. Dr. Le Benger, I want to thank you so much for joining us and continue to educate folks every day. Thank you, Doctor.
I really appreciate it. Have a great day.
We appreciate you. I'm Steve Adubato. That's Jeff Le Benger. Thanks for watching. We'll see you next time.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by the Turrell Fund, supporting Reimagine Childcare. PNC, Grow Up Great. Delta Dental of New Jersey. Hackensack Meridian Health. MD Advantage Insurance Company. The New Jersey Education Association. The Robert Wood Johnson Foundation. NJM Insurance Group. And by the Healthcare Foundation of New Jersey. Promotional support provided by NJ.com. And by the New Jersey Business and Industry Association.
Right now, 6 feet can feel like a long ways away. But from 6 feet, we can still smile at each other. From our doorways and our stairways, from opposite sides of the street and opposite sides of the country. Through fear and frustrations, we can remind each other that we are still here for each other. Because we can still smile at each other, and we're not going anywhere.